Hey guys, just give me a second. So guys, welcome to Let's Crack NEET PG. I'll just begin the session in another. So let me just inform people about today's session. I got today's session's link a little late. I'm a little sorry about the delay. I'll just give me 2 minutes. For those of you who are watching a little late, or if you're watching on another date, you guys can skip to the initial few minutes. Right. Really sorry about the whole delay, guys. So everything is set up now. Let's begin. Set up my phone here. Yes. Video starts here. Welcome to Let's Crack NEET PG. Mm. Welcome to Let's Crack NEET PG, the YouTube channel of Unacademy, their NEET PG division. So here you have the top educators, quality content, and you are assured a great learning experience in whatever way you've been learning, right? So in whatever subject or whatever course of instruction is going to be there for that. So about me, first of all, my name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS, New Delhi. I'm an educator on Unacademy for anatomy, physiology, and biochemistry currently. So I can be teaching any of these subjects, and I tend to take more classes for anatomy and physiology, right? And I'm soon planning to take a few for biochemistry as well, right? So that's for this. I'm a third semester student, and my UG entrance examination rank was 4 in the All India entrance, and in it was All India rank 5 in the JIPMER UG entrance examination, right? Those are my UG entrance examination ranks, and as you all know, all of these exams have been merged to the next to the NEET examination, and for the PG, the entrance examination is called as the next examination. Some of you might be appearing for foreign medical graduates examination, and as you all know that today there was an exam that was conducted called as the INICET, right? So that was an exam that was conducted today. So soon Unacademy will also be creating content related to this examination and its analysis for your future references, right? So moving on, today what we are doing is Thorax MCQ Marathon part 2. We're going to be doing part 2 of this. So yesterday we completed questions 1 to question number 50. I checked, we have around 145 questions to complete in total. So today I am planning to take this from question number 51 at least till question number 95. Let's hope we can take it to question number 100. It depends on how much time we are going to take. Yeah. So before that, I have to tell you a little bit about the Unacademy program. So you guys, you can either pause the video and come back in 5 minutes if you are not interested to know about this, or I would recommend that you actually listen to this because this will tell you why the Unacademy subscription is useful for you. Okay. So I'll also be telling you about all the discounts. I'll be telling you about all the prices. So do listen to this. If you're watching this on a later date, you can go ahead and skip through this, right? So welcome to Unacademy. So as you all know that this video is on YouTube. So this is a free class on YouTube, but there is lots of this content. So this is just the tip of the iceberg. There is a lot of content like this on the Unacademy learning app, and all of that you will find dedicated to your NEET PG preparation, right? On YouTube, you will have so many distractions, but all of those are not going to be there on the Unacademy learning app. It is completely focused for your studies, right? So that is, here you can see that there are more than 10 million plus downloads are already there for the Unacademy learning app, and it's one of the top apps in education, right? And it's definitely the largest player when it comes to online or offline education. So you can see there are, so I would ask you to go ahead to the Play Store, right, and download the Unacademy learning app. That's a must for you. Besides that, you can see that there are a lot of top educators for NEET PG who are teaching on Unacademy. Various surgeons, various professionals, various radiologists. A lot of them have done their degrees from my institute, that is AIMS. Some of them are from Maulana, and there are a lot of educators from various top colleges, right? And you can see that their videos are well watched. They have a decent number of followers, and they're all teaching for plus as well as normal courses, right? So see, here you can see these are Unacademy Plus courses, alright? And these Plus courses are locked courses, which means you need an Unacademy subscription to view these courses, right? So you need a subscription to view these courses, and they are very comprehensive, very detailed courses for whatever particular subject they are. There are 3 types: preclinical, paraclinical, and clinical. I'll show you later also. Then there are batch courses also, which are made together by multiple educators. And besides that, you can see, for example, if you want to learn about clinical MCQs and physiology, there is a course for that which you can watch. So I have also made a plus course. I have already scheduled it, right? I am yet to take it, and I would ask you all to enroll for this course. This course is for gastrointestinal physiology. That's your first prof subject, right? That's your first prof physiology topic, and it has a weightage of 2 to 3 MCQs in the NEET PG entrance. Okay, and besides that, in your prof examinations, it is a sure 10 marker. Okay, I'm planning to cover it in detail, and I'm also planning to do around 100 MCQs here in this course. I'll also do some MCQs on YouTube for this particular course. The rest will also be on Unacademy Plus. This is the course structure for this course, particular course: 22nd, 23rd, 24th, 25th. These are the 4 days in which you will be having this course, right? And introduction to GIT, basic electric rhythm, GIT movements and motility, hormonal physiology, digestion and absorption, MCQs, doubts. We'll be covering it all as an Unacademy Plus course. So it starts on 22nd. So you all do take your subscriptions before that if you want to attend this course, right? So about special classes on Unacademy, so there are two things. Like I said, there are some paid courses, but we all also try to make free content on Unacademy, which can be accessed by everyone, because the ultimate goal is to make learning accessible to everyone, right? So, for example, if you want to learn about the embryology of the heart, there is a lecture for that. You can learn about it here. Okay. So similarly, every educator for their own subject, they make special classes. I have made a few special classes. I would really recommend that you go ahead and watch the special class on coronary circulation. Then I had made one on basal ganglia, and I had made one on arteries of upper limb. So there is so much content for your exams that you can study through watching any one of this class. That will be very high yield class for your examinations. And I'm seriously telling you, they will have all the key points, they will have all the notes, they will have all the diagrams for your understanding, so you won't need anything else. Other benefit of downloading the app besides the free special classes is the free mock tests for NEET PG 2020, right? And you also have the option for weekly mock tests, which are going to be included in the plus subscription. They are included in the plus subscription. So you get access to a unlimited question bank of Unacademy, right? Part A is preclinical, part B is paraclinical, like I said, where you have your second prof subjects, and part C is your clinical. So you know the next examination that is going to be a clinical based examination that is going to be more focused on the clinical subjects. So Unacademy is totally up to date. You can see that we have made the maximum courses for clinical, right? And then 10% weightage is there for part A and part B. So you have a few lesser number of courses for part A and part B. Then there are batch courses running, which include the entire syllabus. All right. So now why you should be learning online, or why you should be learning via Unacademy, is because it's the easiest way to learn for NEET PG online, since you have the option of a flexible schedule. You can learn in the language of your own choice, whether it be English, whether it be Hindi, or if you like learning in a regional language. I swear there are teachers on NEET PG teaching in your Tamil. There are teachers who are teaching in their specific regional languages, even for NEET PG. Even though I try to restrict myself to English, since ultimately all your standard textbooks, they are written in English. So you should have a decent knowledge of English. Try to up with that if you have some difficulties. Anywhere you feel that you get stuck, मैं बिल्कुल तैयार हूँ हिंदी में रिपीट करने के लिए, एकदम पूरा हिंदी में बता दूंगा, ठीक है, कोई टेंशन नहीं है उस बात में। तो फ्लेक्सिबल शेड्यूल रहेगा आपका, ठीक है। यहाँ पे आपने जब देखनी है क्लास आप तब देख सकते हो, दिन में सारा दिन चलती रहती है क्लास। आई एम टेकिंग क्लास एट 9 p.m. tonight. Yesterday or 2 or 3 days back I had taken a class at 10 p.m. also, so that's not an issue. And you have unlimited practice. You can attempt a class whenever you want, you can attempt a quiz whenever you want to attempt it, okay? So unlimited is going to be there for you. Now go ahead to the Play Store and install the Unacademy Learning app. What are you waiting for? And see, Unacademy, there's other features. So right now here, I have opened the chat box here and I can read everything that you are writing in the live chat. On the Unacademy platform, you have a live chat option where it's a very robust system where the live chat shows. Plus subscribers, they have more visibility on the live chat, so their messages are more likely to be read. That's another benefit of the plus subscription. Then you have interactive polls. I will also take this class as interactive polls. I will be asking you questions. And yesterday I was planning to take a quiz on the Unacademy platform, but then there were lesser number of people left, so I did not take that. So please stay till the end of the class, so that if there are at least 10 to 20 people, I'll take a class, I'll take a quiz on Unacademy, I'll host a quiz for you. You have to enter the code in the app, and then you can attempt all the questions in that quiz, right? And that will be a quick, like a rapid fire round, okay? And then we have the benefit of learning anytime, anywhere we want. Okay. आप में से कितने लोगों के पास अनअकैडमी लर्निंग ऐप है ऑलरेडी इंस्टॉल्ड? Guys can tell me if you already have it installed. We can do it midway through the class also. Okay? So what is Unacademy Plus? Unacademy Plus, what all do you get? You get live classes, you get live tests and live quizzes, right? You get batch courses and you also get a structured schedule. Get all of these elements in your Plus subscription. Okay. So I told you batch courses, there are educators who take them together. Then what are iconic subscription plans? Iconic subscription plan is one step beyond Plus. It is for those people who are very serious for their NEET PG preparation and want to crack with a top rank. ठीक है? तो क्या होता है? Unacademy Plus भी मिलता है and you also get Prep Ladder. So Unacademy, India's largest online learning platform, they have acquired the medical subscription app called Prep Ladder, where you have very good teachers like GRG sir and Apurv Mehra sir. Teachers take pharmacology and ortho, and these are well-known educators for their fields. So you get all their video lectures, you get the updated question bank, updated rapid revision courses, and handwritten notes, which otherwise cost rupees 6,500 if you purchase them separately. Okay, so look here, these are the pricing plans. If you look at the pricing plan for Iconic, that is the one that I feel that you should go for. Try it out for 1 year, right? Or if you're in the final year, it makes sense to take it for 1 year only, because try to clear it in one attempt. You get a 10% off with my referral code, that is Chetanya10. Yeah, रेट 10% ऑफ मिलेगा, कोई कैशबैक नहीं है, सीधा 10% डिस्काउंट लग के प्राइस कम हो जाएगा. इसके अलावा यू विल हैव द ऑप्शन टू यूज क्रेडिट्स, and credits can give you an additional 10% off if you know how to use them well. You can ask me if you need any help, right? Nobody else will probably be giving you this help. You can contact me directly. This is my Instagram username. Just text me there, or this is my Telegram @NEET PG Chetanya. This is my Telegram channel. If you join my Telegram channel, you will have the option to join a discussion channel where you can again directly contact me. Okay, so you can directly text me here and we can get in touch regarding a Plus subscription. Just text me that you want a Plus subscription and I will be willing to help you out. Okay, so that's about this. These are the other plans. So this was 1 year. You also have for 1.5 years, for 2 years, and for 3 years. And if you are a second prof student, or you are serious about your MBBS and you are in the first prof and you want to start preparing right from the start, take the 3-year plan. The 3-year plan makes a lot of sense because this is 92,000. A 10% discount would mean that this becomes 82,800. And that would be very economical if you, because you are not only getting Unacademy Plus, remember you are also getting complete access to Prep Ladder. All right. And don't forget to use my referral code, otherwise you'll be missing out on a discount, you'll be missing out on how to apply credits, and that is what you should be doing. Okay, this is the subscription plans for Plus. 1 month is for 5,000. So look at the 1 year plan, that's for 27,500. After discount that becomes less than 25,000. 2 years it becomes around 35,000, 36,000, and 3 years becomes 45,000. So basically if you apply credits, this will come down to 40,000. So 3 years, 40,000 Unacademy Plus. That looks like a very, very attractive offer. That's my referral code Chetanya10. You can apply this to get all these discounts, and you can also use credits. I have told you repeatedly to use credits if you have them, because they can give you at least extra rupees 1,000 off, and they can give you up to rupees 5,000 off here in case of Unacademy Plus. Okay, if you know how to use them well. If you don't know, you can contact me directly. Okay, I've given you my contact details. So this is where you apply the referral code. This is the option to apply the referral code. That is where you write Chetanya10. You can also use a shorter referral code, that is SPCM. That is also a referral code, and both these codes, they are valid for any Plus course, whether it be for IIT, whether it be for UPSC, whether it is for NEET UG. For all of these courses, these referral codes, they are valid and you can use them for any of these. Then you have the option to apply credits and you can redeem these credits. Just click on apply and all these credits will automatically get applied to your referral course. These are the plans. 1 month, 1 year comparison दिया हुआ है iconic और yeah. So let's start with question number 51. Guys, it's your turn to answer. And do one thing. If you're watching this video, go subscribe to my Telegram channel at the rate NEET PG Chetanya. I will be uploading this PDF also there, so you will get a question bank directly there also, which will be very helpful for your future also, because you will need all these questions when you are preparing seriously for your NEET PG. And do hit the like button for this video. हाँ हेल्प कर दो मेरा like button दबा दो. Arnim Goyal, it's okay, relax. And then tell me the answer to question number 51. Does anybody know what will be the answer to question number 51? Do you know how to solve this question? Structures that pass from thorax to abdomen behind the diaphragm are all except. Purnam, please don't spam the chat here. Okay. Right. So Utsab Bandyopadhyay has given the answer as D. That's the correct answer given by Utsab, Mishti, and Sukanya. Three of you have given the correct answer. Thank you so much. Swarnim, you're most welcome to AIMS, and when you reach AIMS, do contact me. Okay. Keep studying from Unacademy. Try to reach your goals, and you do renew your subscription. Use my referral code. Yeah. So see, this is the aortic opening. This is the aortic opening that is present behind the diaphragm. This is the aortic opening present behind the diaphragm. So you can see that the greater splanchnic nerve actually it passes here, right? It is not passing through the aortic hiatus. These three structures, they pass through the aortic hiatus, the azygous vein, the aorta, and the thoracic duct. These are structures that are passing through the aortic hiatus. Whereas the greater splanchnic nerve, it does not pass through the aortic hiatus, right? That is an opening in the diaphragm. The greater splanchnic nerve, it actually pierces, like I said, it actually pierces the crura of the diaphragm. It actually pierces the crura of the diaphragm. Okay. Let's move on to question number 52. Most common site of Morgagni hernia. Parnim, I hope you are not offended by anything I said. Please don't mind. I will unblock you. Don't worry. Zero 77561. Okay, so Utsab has answered this question. So see, sorry, this is a spelling mistake. This is supposed to be left. Supposed to be left. Kanya has answered right posterior. Okay, so Sukanya had attended yesterday's class. Sukanya, you should remember from yesterday's class that we talked about a hernia known as borshodelic hernia, right? This is not the borshodelic hernia. We are talking about the We are talking about the Morgagni hernia. We are talking about the Morgagni hernia. Look here. First of all, which is the right side and which is the left side? This is the right side. This is the left side. This is known as hernia of Boscherdelic. This is Boscherdelic hernia. This is Boscherdelic hernia. And this is Morgagni hernia. Alright. First thing, this is Boscherdelic hernia. And this is Morgagni hernia. So this is basically called as retrosternal hernia because it is present behind the xiphoid process of the sternum. So although Boscherdelic hernia, it can occur on both sides, and even Morgagni, it can occur on both sides. Around 70 to 80% of Boscherdelic hernias, they occur on the posterior left side. They occur on the posterior left side, whereas the Morgagni hernia occurs on the anterior right side. Okay, this is the difference between Morgagni and Boscherdelic, diagonally opposite to each other. So the answer for Utsab is wrong. Rest, Sukanya, Mishti and Saini, they have given the right answer. So answer is option C, right anterior. Let's move on to the next question now. Question number 53. So Utsab is giving very fast answers. I really appreciate it. So Utsab has said that the answer to 53 is D, has a large vertebral body, right? Do you guys agree with it? Right. Since nobody else is replying, I'll go ahead with the answer. So all of the following characteristics differentiate a typical cervical vertebra from the thoracic vertebra except. The answer is option D, has a large vertebral body. So remember the cervical vertebra, it's not very large. It's kind of small, although it's broad from side to side. It's broad, but it's small, right? Now, which one has a large vertebral body? Remember the lumbar vertebra. It has a very large and thick, dense vertebral body. The lumbar vertebra, which has a very large vertebral body. Okay. So the cervical vertebra, it does have a triangular vertebral canal with a foramen transversarium, right? It does have foramen transversarium through which what passes through foramen transversarium? Vertebral vessels, right? Vertebral vessels, they pass through the foramen transversarium. Then you have the superior articular facet. It is directed backwards and upwards. That's true for the cervical vertebra, and that's also a point of difference. So just have a look here. This is the cervical vertebra. You can make out this is relatively small. This is relatively small. It does not have a large vertebral body that is there for the lumbar vertebra. This has a large vertebral body. So that's about this question number 53. So we are here at question number 53 of our session. Then moving on to question number 54, a potential anastomosis seen in. Guys, I can see a lot of you are watching and you're online. Thank you so much for your support. Do remember to hit the like button for this particular video, and if you can, drop a comment if my videos have been helping you. If you want me to make some particular video, if there is some topic that you don't understand, do let me know. You can also communicate with me at my Telegram channel, that is at the rate NEET PG Chetanya. Don't forget that my plus referral code is Chetanya10. If you use this referral code, do let me know. You can contact me anywhere you want. Yes. 53 Utsab, yes, it's D. Tell me about 54. So what basically means by a potential anastomosis? What is a potential anastomosis? What do you mean by potential anastomosis? Utsab, I've already taken a class on perineum. Just go to my videos. I'll tell you. Uh, Go to my channel. Go to this YouTube channel, that is Let's Crack NEET PG. This very YouTube channel. Then there is a playlist there called as Anatomy Basics. There is a playlist there called as Anatomy Basics. You can go through this playlist. I have made a video on perineum. I have definitely made a video on perineum because I know that perineum is one of the difficult topics. So 54, the answer is going to be yes, absolutely correct. So I think Sukanya has just googled what is a potential anastomosis. Potential anastomosis, first of all, please realize she's right in saying that it is a union of terminal arterioles. It is a union of terminal arterioles. But what does it actually mean? It actually means that it is a anastomosis which is very slow to develop, which is very gradual to develop. It takes time for such an anastomosis to develop. Takes time to develop. Yeah, it's basically a function. So that's why coronary arteries. They although they do have anastomosis, they are called as functional end arteries. Why? Because their anastomosis, they are not very efficient. They do not develop in time. By the time they develop, there has already been a lot of damage. So they are functional end arteries. So remember, potential anastomosis here it refers to coronary arteries. They have anastomosis at the level of their arterioles, but they are functionally not very good. Uh, they're functionally not very good anastomosis. Yeah, these are a few examples of potential anastomosis. Question number 55. Let's move to question number 55. Very simple question. You know what is Gartner's duct? What is Gartner's cyst? Where do you see Gartner's cyst? Where would you find Gartner's cyst? Have you heard of Gartner's cyst? What is Gartner's cyst? right? So Mishti has given us an answer that an elongated lymph sac of the cisterna chyli is called as the thoracic duct, right? So I think Utsav had also answered, but then Utsav retracted the answer. So if you look here, yes, Gartner's duct is seen in the genital system, right? So I'm not discussing that right now, but I just wanted to give you a hint that what this is going to be, right? This is going to be seen in your genital system. This is going to be seen in your urogenital system. So this is your cisterna chyli, which is also known as the accessory heart or the second heart, right? This is called as the accessory heart. Why? Because it pumps lymph. Because it pumps lymph. This is the azygous vein. This is the thoracic duct, which comes out from the accessory heart, that is your cisterna chyli, right? That much is clear. Question number 56. In a case of chest pain with pericarditis and pericardial effusion, pain is referred by. Question number 56. Okay. Utsav has already answered for 56 that for pericarditis and pericardial fusion pain is referred by the phrenic nerve. Pain is referred by the phrenic nerve. Okay, are there any disagreements to this answer, or should I tell you the correct answer? Does everyone think it's phrenic nerve? Right. Usman Arshad has also said that it's phrenic nerve, so that's absolutely the correct answer. The pain of the pericarditis and pericardial infusion. So we'll see what happens basically. When you talk about pericarditis and effusion, what pericardial effusion? There's accumulation of fluid between the parietal layer of pericardium and the visceral layer of pericardium, right? So there are two layers of this tissue of your modified mesothelium around your heart, right? So the pain sensitive out of these two layers, your fibrous pericardium is pain sensitive. So whenever there is pericardial effusion, the fibers that are going to be affected will be through the parietal pericardium, right? The parietal layer of pericardium that is towards the outside, or the fibrous pericardium. Those are the pain sensitive fibers. And these pain sensitive fibers, they are carried by the phrenic nerve. They are carried by the phrenic nerve. Alright? These phrenic nerve fibers, they also go to the shoulder and everywhere. The phrenic nerve causes referred pain from these fibers, right? Question number 57. We are on question number 57. It's very easy to make out. Why is that? Why am I saying that? Because the options are too easy. The options, they're very, very easy. Suma is also saying the answer is option D, transversus thoracis, right? So that's the correct answer. And the way you could have isolated that is that It's a pleural tap in the mid-axillary line. The transversus thoracis, it is not present in this region. So obviously it will not be pierced. All of these are intercostal muscles. They will be pierced when you take a needle, when you pass a needle here. So you can see this is how you mark the site for needle insertion, and you actually carry out such a pleural tap. And what you will do is, so the layers, the various layers that are there is, the outermost layer is external intercostal, the layer just inner to it is the internal intercostal. Then you have a neurovascular plane between internal and innermost intercostal, right? The transversus thoracis, it will not be there in this region because there are these three will be there, and between the intercostal vein, intercostal artery, and intercostal nerve, you will have the, behind that you will have the innermost intercostal. So basically, if I were to draw this for you schematically, this is the external intercostal, this is the internal intercostal, and this is the innermost intercostal. Between them you have the neurovascular plane. Between them you will have the neurovascular plane. So you see these three, they can easily be damaged while any structure is being passed through here. But remaining structures, the transversus thoracis, the first thing that the pleural tap is taken in the question says that the pleural tap has been taken in the mid axillary line. So where is that? I hope I've kept an image of the transversus thoracis. I haven't, right? Transversus thoracis, I'll show you. This is basically your transversus thoracis. You can see it begins, this is the site of origin. The sternum comes from the xiphoid process, it comes, right? It passes upwards and it inserts on the second, third, fourth, fifth, sixth ribs, right? That is where it inserts. So it is nowhere related to the mid-axillary line, which is somewhere here, right? So the transversus thoracis, it is present much more centrally. It is in the same plane as the innermost intercostal, but it will not be there when you talk about the mid-axillary line. When you talk about the mid-axillary line, right, affecting the pleura, the transversus thoracis muscle, there is no chance that the transversus thoracis can get pierced. Okay? Because I'm clarifying this because somebody had a doubt specifically with regards to transversus thoracis. Usman has said that transversus thoracis, he was not sure. So now we want to be sure about everything that we do. So the answer is option D. We've seen where the muscle is attached and we know for a fact that it will not be involved. Question number 58. Let's move on to question number 58. Okay, so you guys are confused between B and A. I can make out. So Suma says it's this. Zubair Ahmad says it's bronchus. And Usman says it's also bronchus. So read the question very carefully. Okay. So Zubair has changed his answer. Read the question carefully. It says root of the left lung. Do you know left lung versus right lung for this? Do you know left lung versus right lung? Which one is so? Because that's the reason why this question has been asked, right? That's the reason why this question has been asked, because there is a great difference between the left and the right root of the lung. So that's why that's the principle. So every time you see a question, try to figure out that why has the examiner been wanting to ask this to you, right? Try to figure out why the examiner has asked the question to you. So Nikita is also saying bronchus now. So the correct answer, according to standard textbooks, it's pulmonary artery. It's pulmonary artery. Have a look at the roots of the left and the right lung. Right? This is the root of right lung. This is the root of left lung. You can clearly make out. So the question asks the structure which is most cranial. Right? I hope you understand cranial means towards the head, and this means caudal. Superior means cranial and caudal means inferior. Right? Instead of cranial, that person might also write rostral. Person might also write rostral. So the most superior structure here is the pulmonary artery. No doubt it is the pulmonary artery. The bronchus is inferior to it. And so are the pulmonary veins. So this blue structure here actually is the pulmonary artery. Why is it drawn as blue? Because it carries deoxygenated blood. But it is the pulmonary artery coming from the heart. Right? The pulmonary veins, they are located antero-inferiorly. They are located antero-inferiorly. Then beside that you have the bronchus. Right? On the right side, this bronchus, this particular bronchus, this is the most cranial structure. On the right side, the bronchus is the most cranial structure. Whereas here you can see it is not. It is not. Okay. That was the reason why this question was asked. So I have told you to analyze why some person is going to ask you something so specific. What is the most cranial structure in the root of the left lung? Why this question will be asked? Because it must be different in the left and the right lung. It's going to be different in the left and the right lung. Let's move on to question number 59. If circumflex artery gives the posterior interventricular branch, this is called as right dominance. Mishti, you are saying the Mishti is answering for question number. Okay. So Zubair and Ustad and Suma have answered for this question. That is option B, left dominance. Very clear, because you know the left coronary artery, it divides into two. Divides into the left anterior descending artery and the circumflex artery. In around 10 to 20% of people, okay, we go with 10% of the people, it gives the posterior interventricular artery, and based on who gives the posterior interventricular artery, it is called as the left dominance, right? So I have already told you that India is right, Pakistan is wrong, or Pakistan is left, and posterior interventricular artery is Kashmir. India, Kashmir, Pakistan. That's how I made you remember this. There was one more concept associated. That is why I am revising this for you. Okay, if you want, I can skip it. but I did it on the Unacademy platform. So you might not have watched this class. So I'm doing this for you so that you don't make a mistake. And I'm doing this because somebody did get confused here, right? So India, Pakistan, and that's Kashmir in between. We'll draw Kashmir with, let's say, yellow. Now, what is Kashmir? Kashmir is posterior interventricular artery. I'm sorry if someone from Pakistan is watching this, alright? This does not mean anything. This is just a way to remember this, right? Please, I hope nobody be offensive in any way, right? So the posterior interventricular artery, it can either arise. So India is, so since I am an Indian, I'm going to say that India is right. And somebody from Pakistan will obviously say Pakistan is right, but go ahead and write left here. So if the posterior interventricular artery, so there are both opinions, right? There are both opinions. Most of the people, since also the population of India is more, say that the posterior interventricular artery, it comes from the right coronary artery. So in 90% of the cases that happens. And in 10% of the cases, it arises from the left coronary artery. And basically not from the left coronary artery, but from the left circumflex artery. Remember, not the left coronary artery, the left circumflex artery. Now, why do I make this entire comparison? Why do I make this entire mnemonic? To help you remember which kind of circulation is better. Which kind of circulation is better, right? So there are three kinds of dominance: right dominance, left dominance, and there is codominance. There is also codominance. So 90% of the cases there is right dominance, 9 to 10% of the cases there is left dominance when it comes from the left circumflex artery. Only around 1% of the times there is codominance. Okay. Please, those who are watching this from Pakistan, please don't get offended. I have nothing against Pakistan. And I know for a fact that a few people from Pakistan do watch my videos because I did get some positive feedback from their side. Thank you so much, guys. I do appreciate all your love. Let's continue here and tell you that the right cardiac dominance. So, since I am an Indian, I'm going to say that which is better. Kashmir goes to India, Kashmir goes to Pakistan. It's better that Kashmir goes to India. So, right cardiac dominance is better than left cardiac dominance. So, right is better than codominance and codominance is better than left. Now, you know the logic for that because the posterior interventricular artery, it supplies the left ventricle. It does supply the left ventricle to some extent, the posterior wall especially, है ना? Since it supplies the left ventricle, the rest of the left ventricle, it is mainly supplied by the left coronary artery. So left coronary artery, it is already supplying a lot of the left ventricle. Now, if the posterior interventricular artery, it also comes from the left ventricle, then the left ventricle becomes much more vulnerable to a thrombosis in the left side, right? So if there is a blockage of the left coronary artery, your entire left ventricle will go on and you will have sudden cardiac death. You will have sudden cardiac death. But if some part of your left ventricle is supplied by the right coronary artery, and even if there is a damage to the left coronary artery, the right coronary artery, it can still compensate for some of the supply. That is why I am saying that the right coronary circulation, it is better than, right dominance is better than codominance, and codominance is better than left dominance. Not because India, Kashmir, Pakistan, that's just a way for you to remember things. That's just a way for you to remember things. Dominance is decided on the basis of who has Kashmir. Dominance is going to be decided on the basis of who has Kashmir, and Kashmir is posterior interventricular artery, right? So if you want, you guys can take a screenshot of this particular slide where I have explained the entire concept to you. Okay, this is what you have to write when you are asked about cardiac dominance. So right, so this was, I've already explained this to you, right? Posterior interventricular artery is a branch of the right coronary artery, circumflex artery, and that is about this. So this is from my lecture on Unacademy. There's a lecture on coronary circulation on Unacademy. Do download the Unacademy learning app. Let's start with question number 60. Direct opening in the right atrium. Right, direct opening in the right atrium is of the, okay, so we're saying oblique vein. Oblique vein. Okay, so now what is the oblique vein? Oblique vein is also a tributary of the coronary sinus. Later, I'll show you where I have an image where I don't have the oblique vein, but I'll show you what essentially the oblique vein is. It is a, it opens into the coronary sinus. Remember, it is one of the tributaries of the coronary sinus, oblique vein. So oblique vein is called as oblique vein. If you remember, oblique vein is known as the oblique vein of Marshall. It is known as the oblique vein of Marshall. Okay. So it has some embryological significance. I'll tell you about it. There is a question in today's class that is related to this embryological significance, right? So direct opening in the right atrium. Remember, I told you it is the anterior cardiac vein. This question was there in yesterday's MCQ session also, if some of you attended. The anterior cardiac veins, they open directly into the anterior wall of the right atrium. So generally, I try to keep some questions from yesterday's class also, so that people, they are attentive, they are also revising what they did the previous time. So anterior cardiac veins, they open directly into the walls of the right atrium. So there are great, middle, small, and anterior cardiac veins. Out of these, the first three, they drain into the coronary sinus. Anterior cardiac veins, they are the only cardiac veins that do not drain into the coronary sinus. There are other veins also, like the vena cordis minima, which do not drain into the coronary sinus. They drain into all the chambers of the heart. But anterior cardiac veins, there are two things that are special about them. That they drain, first of all, that they don't drain into the coronary sinus, they drain directly into the right atrium. Second, they drain anteriorly. The rest of all the venous system, they drain generally posteriorly because the coronary sinus is present posteriorly. Okay. Question number 61. Question number 60. Again, these two sets of questions, they were there from yesterday's class also. So it's very important that you remember what you studied yesterday. I think Mystery does remember what she did yesterday. Even Utsav is aware of this answer. Zubair is also aware of this answer. Wrong. The lungs bronchial arteries supply the bronchopulmonary tree till. So till what level do they supply? Till what level do they supply the bronchial arteries? The answer that you all have given me till segmental bronchi, let me tell you, it is the wrong answer. It is the wrong answer. Take another guess, guys. Take another guess. Take another quick guess. Right. So now it's has taken the right guess that it is still the respiratory bronchioles. So it's pretty factual. I told you yesterday also. I don't expect you guys to know this, but now that I have told you कि एक बार बता दिया तो दिमाग में बैठ जाना चाहिए कि ब्रोंकियल आर्टरीज जो है वो पूरा रेस्पिरेटरी ब्रोंक्यूल्स तक सप्लाई करेंगी। ठीक है। जो टर्शरी ब्रोंकाई है वहां तक तो आपका जो लगा लो सेगमेंट शुरू होते हैं ब्रोंकियोपल्मोनरी सेगमेंट, तो वहां तक तो सप्लाई करेंगे ही करेंगे। दे सप्लाई टिल द लेवल ऑफ रेस्पिरेटरी ब्रोंक्यूल्स, उसके आगे सप्लाई नहीं करते एल्वियोलाई वगैरह को, बट टिल देयर दे डू सप्लाई। राइट उस्मान? क्वेश्चन नंबर 62। I showed you a very beautiful image to make you understand this. So we haven't covered the tributaries of thoracic duct, so we'll just do it also. thoracic duct की tributaries भी कर लेंगे इस बहाने। Right. So thoracic duct, it receives tributaries from all of the following except. Okay. So basically क्या होता है? जो thoracic duct होती है, it is mainly, so if you know the lymphatic drainage of a human, you look at it. I will try to make an approximate section. So if this is the right side, this is the left side. Okay. If I make it like somewhat like this, ये जो part होता है, that drains through the right thoracic duct, the right side. Okay. And then the remaining, it drains through the thoracic duct. It drains towards the left side. Okay. तो सिर्फ इतना part होता है, half of the head, half limb. Okay. It means the right limb, the right neck, and part of the right thorax that drains into the right side. ठीक है. तो right bronchio-mediastinal lymph trunk, like for 62 you all are answering option D. That is the correct answer. Okay. Otherwise, the ascending lumbar trunk, bilateral descending thoracic trunk, left upper intercostal duct, all of these will drain into thoracic duct. But except right bronchio-mediastinal trunk, which does not drain into the thoracic duct. ठीक है? देखो ये रहे लंबार ट्रंक्स, ठीक है, ये बायलेटरल लंबार लिम्फ ट्रंक्स हो गए, ठीक है, ये गई सिस्टर्ना केलाई बना, सिस्टर्ना केलाई से यू हैव, सो दीज आर द डिसेंडिंग thoracic lymph trunks, then they will form the thoracic duct, it deviates towards the left, then thoracic duct goes over like this here, receives the left jugular lymph trunk, receives the left bronchiomediastinal lymph trunk and the left subclavian lymph trunk, right, and then it drains into the brachiocephalic vein of the left side. It drains into the brachiocephalic vein of the left side. On the right side, if you look at the brachiocephalic vein, at the junction of the left subclavian and the left internal jugular vein, you will have the trunks entering. You will have the right side trunks entering through the right lymphatic duct. And you can see the right bronchiomediastinal trunk. The right bronchiomediastinal trunk, it enters into the right lymphatic duct, not the thoracic duct. So there are three trunks that enter the right lymphatic duct. That's the right jugular trunk, right subclavian trunk, and the right bronchiomediastinal trunk. So just write it down. Right lymphatic duct will receive the right jugular trunk, will receive the right subclavian trunk, you will receive the right bronchiomediastinal. These are the three trunks that will be going here. Okay, Dr. Rupam, how are you? How are you, Dr. Rupam? Hope you're doing well. Let's move on to the next question. Question number 63. Wondering how many of you will be coming to Pulse next year? Man, you are thinking right this time, right, buddy? So Zubair, Utsab, and Saini, you all have been able to answer correctly. That the fibrous pericardium it is attached to. यार एक बात बता दो प्लीज. आई होप वो पाकिस्तान वाली बात पे कोई ऑफेंड नहीं हुआ. Fibrous pericardium is attached to. Fibrous pericardium is attached to. ठीक है. So the answer is going to be option A, central tendon. The answer is A, central tendon. Fibrous pericardium, it is attached to the central tendon. So have a look here. This is your heart. This is your heart. And basically you've been shown the liver. You've been shown the diaphragm under it. And this is the muscle or the crura of the diaphragm. And this is the central tendon of the diaphragm. This is the central tendon of the diaphragm. And to it you have the attachment of the fibrous pericardium. Fibrous pericardium, it is attached to the central tendon of the diaphragm. Okay. Fibrous pericardium is attached to the central tendon of the diaphragm. Right, this much is clear. Okay, time to move on. 64. Let me take some water. Yeah. So a lot of you have answered for 64. I don't know why you've been answering. Answer is B, Utsab, Zubair, and Mishti. So the answer that you've given is posterior to the posterior lumbar vein. So the answer that you've given is posterior to the posterior lumbar vein. First of all, answer that you have given is incorrect for sure. Are you writing the right answer? We generally only talk about right. Utsab, I'll tell you, this class is going to go for a few, approximately 1 more hour. If you want a break in between, you can let me know. We'll take a 5 minute break if anywhere you get tired. So the azygous vein, it begins posteriorly to the inferior vena cava, right? It begins posteriorly to the inferior vena cava. This was a made up option. This was a made up option. I actually made this option up, right? So this is not definitely not the answer. I don't know why everyone selected D. The correct answer is option B. It actually begins posterior to the inferior vena cava, directly to the superior vena cava over the root of the right lung, right? Question number 65. This question has been asked in the PGI entrance examination. So this is a multi-answer correct, first of all. This is having more than one options correct. Okay. So write whatever options you think are correct. This might take some time to you. Okay, Utsab. So see, most of my classes, Utsab, they are, first of all, they're not just merely MCQ classes, because for that I can simply host a quiz on Unacademy. The reason why I do these MCQ marathon sessions is that I want you to understand the bisection, the dissection of every question. I want you to have an understanding of every option, of every concept related to that question, so that you know exactly how it has been asked. Yeah. So that if there is some variation to that question, because there is very less chance that the same question gets repeated. The most probable thing is that there is some variation to that question. So it's good if you know all the variations for that question. And this class will probably go on till 11:15. We started at around 9:15. So I'll try to wrap it up by then. But you might have to watch 5 or 7 questions a little later. The best thing you can do is that maybe later you can watch it on 1.5x if you are not willing to participate in a live quiz. But I would recommend that you do watch the video in a live manner because that helps you learn more. Right. Okay. Thank you, Utsab. Thank you, Sam. Thank you, Mishti. You guys have given your answers. Now it's my time to tell you the answer. There are only two options that are correct, and you guys have included one option that is incorrect. See, its nerve supply is from the long thoracic nerve. That's false. Long thoracic nerve supplies serratus anterior. So A is definitely incorrect. The nerve that actually supplies it is called as the thoracodorsal nerve. Please don't get confused by the word thoraco. Don't get confused by the word thoracic. It is the thoracodorsal nerve. Did you guys know that the latissimus dorsi was actually a muscle of the upper limb? It was actually a muscle of the upper limb. It migrated to the back. It migrated to the back. So thoracodorsal nerve. It is also known as the climber's muscle. It is also known as the climber's muscle. Yeah, and it is inserted into the bicipital groove of the humerus. So remember, lady between two majors. There is a mnemonic. There is a very famous mnemonic, lady between two majors. The two majors are pectoralis major and teres major. Pectoralis major and teres major. Who's the lady between them? Lady is latissimus dorsi, Lado lady. Okay, the lady between them. So it is inserted into the bicipital groove. It is used to fill up back defects. Yes, that's the surgical anatomy point. Surgical anatomy. It is, since it's a very extensive muscle, you can take some part of it and you can use it to fill up some defects in the back or some muscular defects there, right? Then blood supply is from the lateral thoracic artery. No, not at all. Its blood supply is from the thoracodorsal artery. Its blood supply is from the thoracodorsal artery, which is a branch of the subscapular artery, which is a branch of the subscapular artery, not from the lateral thoracic artery. Does not originate from the upper four ribs, originates from the lower ribs. Right? So answer is B and C. These are the two true statements about the latissimus dorsi. I hope you are now clear with the answer. Okay. If there are any watchers who are new, please do hit the like button. I would really appreciate that from your end. Okay. So that's the latissimus dorsi. You can see it originates from the lower ribs. It goes like this into the occipital groove of the humerus and inserts there. Okay. Question number 66. We have done this before also. Let's see if you can answer this. So right, the answer is correct for 66 given by Utsab and Mishti. The answer is, and Sam also, the answer is going to be option A, serratus anterior. The answer is going to be option A, serratus anterior. That's correct. So just have a look here. This is going to be your medial border of your scapula. This is going to be your trapezius, the lateral border of trapezius, lateral lower border of trapezius, and the upper border of latissimus dorsi. They form a triangle here that is known as triangle of auscultation. The serratus anterior is located somewhere here on the medial side, on the medial surface of the scapula, right? That is where it attaches. So it is not forming any boundary of the triangle of auscultation. I can see a lot of people have joined. Guys, do hit the like button if you can for me. ठीक है, एक बार thumbs up दे दो मेरे को. जो वीडियो का कमेंट सेक्शन है वहां पे लाइक बटन होगा, लाइक बटन दबा दे and do subscribe for the channel Let's Crack NEET PG, and you can subscribe to my Telegram channel at the rate NEET PG Chetanya. This is a triangle of auscultation. Question number 67. It's one of my favorite questions, right? One of my absolute favorite questions. So, Guy, you're preparing for NEET UG. Hey, Guy, glad you're preparing for NEET UG. You're on your way to be a doctor. Really happy for you. अगर किसी इंसान ने डिसलाइक बटन दबा दिया है, कोई बात नहीं. Guys, read this particular question very carefully. I told you this is one of my favorite questions from this topic, and I love explaining this question. We'll read it very carefully. I'll read it along with you. In a subclavian artery block at the outer border of the first rib, all of the following arteries help in maintaining the circulation to the upper limb except. So we'll start with what the subclavian artery is. So this is going to be the outer border of first rib, going to be the inner border of first rib. This is the outer border of So if you have a look here, I will show you the subclavian. This is till where you have the subclavian artery, and after the outer border of the first rib, you have the axillary artery. This is where the axillary artery starts. So that is where the block is. Axillary artery, and this is the subclavian artery. So if there is a block here, so the blood is not going from the subclavian artery to the axillary artery. Blood is not going from the subclavian artery to the axillary artery, right? You don't have blood flow to the upper limb. You need to restore blood flow to the upper limb. So you need to restore blood flow to the upper limb, right? So what will you do? You will activate the scapular anastomosis. You will activate the scapular anastomosis. So what does the scapular anastomosis do? The first part of subclavian artery is connected to the third part of the axillary artery. That is the scapular anastomosis. Scapular anastomosis, it exists between the first part of the subclavian artery and the third part of the axillary artery. So that will be activated so that you can divert blood from the subclavian artery to the axillary artery through an alternate route. That is the purpose of a anastomosis or a collateral circulation. Alright, so that is what we are going to do. So now, what are the branches that will be involved here? What are the branches that will be involved here? Now, for the third part, what are the various branches that you know of? You know of the subscapular artery. Okay, let's show you the diagram. So you know of the subscapular artery, right? So the subscapular artery is coming here and it gives the circumflex scapular branch. That anastomosis with the suprascapular artery from here, that anastomosis with the suprascapular artery from here, and the deep branch of the transverse cervical artery also anastomosis here, right? The deep branch of the transverse cervical artery, also called as the dorsal scapular, that can anastomose here with the subscapular artery. So these two arteries, they are definitely involved. This is from the thyrocervical trunk. These two, they come from the thyrocervical trunk. So thyrocervical trunk is involved, right? Suprascapular and subscapular. We've seen how all these three are involved. What are the other vessels that are going to be involved, right? Probably to some extent, these arteries can also be involved. But the superior thoracic artery, it is not a branch of the first part of the subclavian artery, neither is it a branch of the axillary artery. Superior thoracic artery, where do you think it comes from? Superior thoracic artery. Superior thoracic artery, it's actually a branch of the first part of the axillary artery. It is a branch of the, it's the only branch of the first part of the axillary artery. It comes from here, right? तो यहाँ तो कोई anastomosis है ही नहीं. ये तो it is just after the blockage, so it will not take part. It will not take part in maintaining the circulation to the upper limb. Superior thoracic artery has no role to play here. Okay, the answer is option B. समझ आया question number 67? It's a difficult question, guys. If you have been able to understand this, please do hit the like button for this particular video and do let me know that मेरी explanation से आपको कुछ clarity मिली इस question में. 67 से 66 पे क्यों चले गए? 68 पे आओ. Aortic hiatus, what does it contain? What mnemonic did you forget? Utsab, tell me. I'll tell you the mnemonic. साथ के साथ बता दूंगा. What mnemonic did you forget? So Mishti has answered. Utsab has answered wrong here, I guess. Sam has answered C. Zubair, Usman, and Saini. All of you have answered option C, azygous vein and thoracic duct. That's exactly the answer I was looking for. You guys are great. So the structures that pass through this aperture: aorta, thoracic duct, occasionally the azygous, and the sometimes the hemiazygous vein. Like sometimes, very sometimes the azygous vein is there. So here, please note aorta, thoracic duct, and azygous vein. So aorta obviously has not been asked because it is the aortic aperture. So you've been asked the thoracic duct and the azygous vein. These two structures have been asked to you. Blood supply of the pectoralis major muscles. Blood supply of the pectoralis major muscles. We are moving on to the next question. Guys, tell me the blood supply of the pectoralis major muscle. Again, very important to note that this has come from the PGI entrance examination. That is straight from the PGI entrance examination. And you have to tell me multi answers, right? So this is a multi answer correct. Content of the three openings, you don't actually need a mnemonic for that, guys. I'll make you memorize the contents of the three openings without any mnemonics. Without any mnemonics. Let's do it without mnemonics. I'll have to show you a table so that hmm, right, I'll just show you the table now. So for 69, you were answering A, B, C, B, A, C, A, B, C, A, B, right? So all of you have answered more or less the same. You answered it A, B, C, A, B, C, that's correct. The axillary artery, it supplies the upper limb. Subclavian artery, it supplies the neck, so it's not here. For pectoralis major, the thoracoacromial artery. Do you know the branches of the further? What are the branches of the thoracoacromial artery? The thoracoacromial trunk. A, P, C, D, right? This is the acromial branch. This is the pectoral branch, the clavicular branch, and this is the deltoid branch. So this pectoral branch from the thoracoacromial trunk that will supply the pectoralis muscle. So the lateral thoracic artery, yes, it does run. So you can see here, this is the thoracoacromial artery which will be supplying the pectoralis major. Somewhere here you have the lateral thoracic artery running, and that is a branch of the axillary artery. That is a branch of the axillary artery. So that is how the lateral thoracic artery, it does not directly supply it, but it does give a branch through which it supplies. So that is how lateral thoracic artery is supplying. And then here somewhere you have the internal mammary artery, which is giving perforating branches here, which supply the the mnemonic for the thoracoacromial trunk is not ABCD, it is APCD, because you have to give a pectoral branch, not a B. It's not a B, it's a P. It sounds like ABCD, but it is APCD. Okay. So do you want to know about the three openings of the diaphragm? If you keep forgetting that, let's take an image. Right. So let's take this image here. So have a look. So there are three openings, like I told you, main three openings: vena cava, esophagus, opening for vena cava, opening for esophagus, and opening for aorta. So now you start from the first thing. The first thing is that this is at the level of T8, approximately T8. This is at T10. This is at T12, right? First thing. T8, T10, T12. That's the first thing that you have to remember. Then it is the caval opening or the vena caval opening. So structure passing through it, it will be obviously inferior vena cava. This is esophageal opening. So one structure is esophagus. Aortic opening, one structure is aorta, right? No doubt about that. So then next, see vena caval opening. It is first of all on the little towards the so the inferior vena cava, it drains into the right atrium. It drains into the right atrium. So accompanying it, you have some nerve. Accompanying it, you have some nerve which is the right phrenic nerve because inferior vena cava drains into the right atrium. So the phrenic nerve of the right side that will be going through the vena cava opening. That will be going through the vena cava opening. Right now, those are the two major contents of the vena cava opening. Besides that, you have certain lymphatics or something. Leave that. Esophageal hiatus, you have esophagus passing, right? Then you have the vagus. You have the vagus, both the right and the left vagus, which form the anterior and posterior vagal trunks that go anterior and posterior to the esophagus. So they are anterior and posterior relations of the esophagus. So that is why you can remember them. Now remember that the gastric artery, remember that the artery that was surrounding that was supplying the stomach. I'm not going into the details, right? So here you had an artery and that was giving abdominal branches to the esophagus. So those abdominal branches, they have to pass through the esophageal hiatus. So small esophageal arteries. And aortic hiatus, aorta, azygous vein, and thoracic duct. That's very easy to remember together. AAT or ATA if you want to use a mnemonic or something. Then the through the right crus, you have the greater and lesser splanchnic nerves. You have a lesser aperture there. Then you have aperture on the left crus where you have the greater and lesser splanchnic nerves and also the hemiazygous vein. Okay, that passes from there. Then behind the diaphragm, under the medial lumbocostal arches, some sympathetic trunk. And that's about the main structures that will pass through the various diaphragmatic openings. Let's move on to question number 70. Let's move on to question number 70. That's where I need your help now. Help me answer question number 70. 70. Right. So welcome Utsav. Utsav and Sam have said the answer is A, areolar tissue and internal vertebral venous plexus. That's absolutely correct. You must be careful. You will not find CSF here. In which layer do you find CSF? That's the subarachnoid. That's the subarachnoid is where you find the CSF. Right? You know where the subarachnoid, where the CSF is going to be present. Please don't mistake your answer here. So have a look here. This is kind of how it is there. This is going to be your epidural venous plexus, and that's where you will have the venous plexus here, right? Internal vertebral. Question number 71, again regarding this. So what all does this epidural space contain? I have not mentioned it enough. So if I were to start telling you little, one of the things that's obviously going to be there is lymphatics. That's going to be there is lymphatics, right? Then you will have the spinal nerve roots. You will have the spinal nerve roots. Besides that, you will have the loose connective tissue. You will have fatty tissue, right? Adipose tissue, that is something that is found everywhere. You will have some small arteries. You will have small arteries, and one of the main things would be a internal vertebral venous plexus. That is one of the main things that is going to be there. Internal vertebral venous. So that is what they have focused on. Most of it is generic stuff. The main specific here was the internal vertebral venous plexus. Okay, 71. We are on 70. Okay, 71. Some of you are saying A and some of you are saying D, right? So the correct answer is the third lumbar vertebra. That is where the spinal epidural space is the largest, right? In the lumbar region near the L3, near the L, yeah, that's where the spinal epidural space is the largest. Come to question number 72. Come to question number 72. Relatively less factual. You can easily think about this. All of the following are true about phrenic nerve except. So right, Mishti is saying 72A. Sub is saying mainly okay. So a lot of you have said A. You're all correct. The answer is option A. It is purely motor nerve. Because see, this is wrong. What are the various nerve fibers that are possible? What are the various nerve fibers that are possible? Sensory, motor, then visceral means autonomic. So these are the three kinds of fibers that are possible in a nerve, and you all will be happy to know that phrenic nerve has all three kinds of fibers. And how you can basically think about it is that referred pain of pericarditis, it is sensory for the fibrous pericardium. It is sensory for the fibrous pericardium itself. So it obviously carries fibers that are there for sensation also, not just motor, not purely motor. So it has other roots. Accessory phrenic is a commonly branched nerve to subclavius. T4 spinal nerve is its root. It formed at the lateral border. It's not order, it's lateral border of the scalenus. Now moving on to question number 73. Sorry, I'm a little sleepy. Okay, right. So I've received a mixed kind of a response. E, C, C. Okay, a lot of you are saying C for 73. 74 I haven't even shown you yet. There's only one correct answer, guys. Only one of these answers will be correct. What is that answer going to be? Who about the left phrenic nerve? The answer to that is going to be option A, right? It's going to be option A. Have a look. I have a figure for you. This is a cross section that I usually show when I want to show you the fascias, when I show you the investing layer of fascia, pretracheal fascia, and the prevertebral fascia. But this works very well here also, right? So what you have to understand first of all is the course of the phrenic nerves and the vagus nerve. They are generally seen together. You try to study both the courses together, right? So when I talk here, somewhere here, this is where you have the carotid sheath. This is where you have the carotid sheath. Yeah, first thing. Then this is covered here by a layer of fascia known as the prevertebral fascia. This is covered here by a layer of fascia known as the prevertebral fascia. Right? So the recurrent laryngeal nerve is shown, which is actually a branch of the vagus. Right? Now here, if you see, this is the phrenic nerve. This is the phrenic nerve of the right side. This is the phrenic nerve of the right side, and this is the phrenic nerve of the left side. This is the phrenic nerve of the left side. This is the phrenic nerve of the left side. Assuming this cross section is made in the way that I am thinking that it is made, right? This is the ideal way of making it. Okay. So if you look at that, because otherwise this section is symmetrical. Yeah. If you look here, there is one thing that is going to be there, that is that it is present anterior to the scalenus anterior. This is the scalenus anterior. This is the scalenus medius. So between the scalenus anterior and scalenus medius, you have the brachial plexus. That's how you identify that. And anterior to it, you have the phrenic nerve. Anterior to it, you have the phrenic nerve. This is true that it lies anterior to the anterior scalene muscles. Now your doubts. It is not located posterior to the brachial plexus. In fact, the brachial plexus is located posterior-medially. The brachial plexus is located posterior-medially to it. Okay, first thing. So brachial plexus is located posterior-medially, so it is located anterolaterally to it. Phrenic nerve. Posterior to subclavian artery. Now the subclavian artery, you will see, this is not the section where you have to see, compare it to the subclavian artery. The subclavian artery is present at a different level. You have to come down for that to see that section. And at that section, you will see that the subclavian artery, it is actually present anterior to the subclavian artery. The phrenic nerve is present anterior to the subclavian artery. Okay, the phrenic nerve, it passes anterior to the subclavian artery. And posterior to the hilum of the left lung, no, it is present anterior to the hilum of the left lung. It is present anterior to the hilum of the left lung. That's a very characteristic thing, that when you talk about the hilum of the lung, when you talk about the hilum of the lung, the nerve that passes in front of it is the phrenic nerve, and the nerve that passes posterior to it is the vagus nerve. That's a very characteristic relation, phrenic and vagus. You have to be very careful. In the neck, the relations are a little different. In the neck, you see here, this is the phrenic and this is the vagus somewhere here, right? So the relations are a little different when you talk about the neck, but when you talk in the thorax, This relation is very specific that anterior to the hilum you will have the phrenic nerve and posterior to the hilum you will have the vagus nerve. In fact, that is how you are going to identify them. Okay. Question number 74. Question number 74. This is what I wanted to show you. Told you I will show you some questions. So this is the question that I want to. Question number 74. So a lot of you have been able to answer 74. Zubair is a very spot on person, right? I feel that Zubair is having very good knack when it comes to answering questions. Sam, Mishti, this question we're going wrong. Just read the question carefully, guys. I will not ask you a question as simple as superior vena cava drains into. ठीक है? कुछ पूछा है तो इसका मतलब शायद कुछ टेढ़ा निकले क्वेश्चन से. ठीक है? तो it's not a very simple question. तो directly right atrium answer मत दो. Right atrium is the wrong answer. Think between B, C and D. Okay, think between B, C and D. पूछा है सीधे सीधे तो इसका मतलब राइट एट्रियम तो आंसर नहीं होगा. So on the left side, left sided superior vena cava drains into. Left sided superior vena cava, it drains into. Where does it drain to? Right? So the left sided superior vena cava, it drains into, possibly it can drain into. No, it's not about situs inversus. The question is not situs inversus. That's not how you see this question. That is not a left sided superior vena cava. Situs inversus नहीं लगाना है. Okay, this is an embryological defect. This is a defect. कभी कभी क्या होता है, दो सुपीरियर वेना कवा आ जाती है, एक राइट साइडेड हो जाती है, एक लेफ्ट साइड हो जाती है. ये देखो, look at the development. This was the sinus venosus. This was the sinus venosus initially, and then you can see that that is how the sinus venosus is embryologically developing. Ultimately क्या होता है, you know, there are cardinal veins. There are cardinal veins. So sometimes what happens is there is incomplete closure of this vein here. There is incomplete closure of this vein here, right? This is the oblique vein of Marshall that I was telling you about, that drains into the coronary sinus. Oblique vein of Marshall, it drains into the coronary sinus. So sometimes there is an abnormal correction that develops here, that is known as the left-sided superior vena cava. That is known as the left-sided superior vena cava, and it drains into the coronary sinus via the oblique vein of Marshall. Because the oblique vein of Marshall, it drains into the coronary sinus, right? The left-sided superior vena cava, it drains into the coronary sinus, not into the right atrium. The answer is option C for question number 74. Clear? So don't think of situs inversus. Cool. बड़ा अच्छा नाम है। ठीक है, तो 75 की बात करते हैं। आंसर यू आर सेइंग इज ए, थाइमस। देख लो, थाइमस थायराइड में कंफ्यूजन होगा। थाइमस और थायराइड, थाइमस और थायराइड। फ्यूजन तो नहीं है थाइमस और थायराइड में? कोई और आंसर दो जल्दी जल्दी। 75 somebody saying D, Subair is saying D, spleen. Okay, Mishti is sure that it's thymus. Very good. That's the clarity you should have. So this is a Hassel's corpuscle. If I show you, that is how you look histologically. That is how it appears. Although your question histo का है, still I am discussing right now because usually मैं gross and net करता होता हूँ. I'll take histo embryo sessions if you guys ask me to, but generally I prefer to take gross and net. So this is what a Hassel corpuscle actually looks like. This is in the thymus. You might have studied this in your 11th and 12th also. Its function is unknown. मेरे को इसलिए इंटरेस्टिंग लगता है ये बिकॉज वी डोंट नो अबाउट इट्स फंक्शन. इट इज जस्ट प्रेजेंट देयर एंड इट इज वन ऑफ द कैरेक्टरिस्टिक फीचर्स जिससे यू कैन आइडेंटिफाई थाइमस बट यू डोंट नो अबाउट इट्स फंक्शन, राइट? क्वेश्चन नंबर 76. क्वेश्चन नंबर 76. इस एक हिस्टो क्लास है. For what do you want me to take a histo class? Can you tell me any topic or do you want me to take general histo? Some session on embryology and histo. Okay, so Mishti and Sam, when are you guys appearing for your examinations? When are you guys appearing for your examinations? Can you let me know? I'll plan accordingly. Tiny Singh D and सुबह अच्छा 76 की बात हो रही है ना? AIT and urinary system की हिस्टो. AIT and urinary system तो बढ़िया है, दे सकते हैं. AIT की तो काफी अच्छी है. Maybe January last week. Okay, right guys. I'll take care of that. I'll try to take January में some classes for these. Which of the following companies the anterior interventricular artery? 76 Mishti is saying A and Zubair is saying B. Great cardiac या middle cardiac? यार मैंने इसका थोड़ा सा तुम्हें बताया था कि the answer is going to be option A, that is the great cardiac, right? Anterior interventricular artery. What's the anterior interventricular artery? The anterior interventricular artery is nothing but the left anterior descending artery. It is also called as the anterior interventricular artery. It's the left anterior descending artery. And see here, what I told you. There's a great cardiac vein, there's a small cardiac vein, there's a middle cardiac vein. So which part of the heart is more functional, the right or the left? The left, right? The where left ventricle, it has to pump blood to the entire body. So it will generate more waste. So it will have more venous return. It will have more venous return. It will have more venous return. Okay. So it gives a vein that is larger. That is larger. ये ठीक है, मैं याद कराने के लिए बता रहा हूँ कि अगर ये कोरोनरी साइनस है, क्या पोस्टीरियरली बात करें, ये राइट साइड है, ये लेफ्ट साइड है, तो इसमें लेफ्ट साइड से जो वेन आ रही है दैट इज लार्जर, दैट इज द ग्रेट कार्डियक वेन। राइट साइड से आ रही है छोटी वेन है स्मॉल कार्डियक वेन, बीच में पोस्टीरियर इंटरवेंट्रिकुलर आर्टरी के लॉन्ग आ रही है वो है मिडिल कार्डियक वेन। So you know this is along posterior interventricular artery, this is along right coronary artery and right marginal artery, and this is following the course of left circumflex artery and the left anterior descending artery. ये उसके साथ आ रही है. Basically, left anterior descending artery is the anterior interventricular artery. So the vein accompanying it is going to be the great cardiac vein. I have summarized this entire thing in my class on coronary circulation. Please do go ahead and watch this class. इसमें सब summarized है. Just download the Unacademy learning app. Download the Unacademy learning app. देखो मेरा दिल Unacademy के लिए धड़के है, वाह. Let's move on to question number 77. Let's move on to question number 77. Sam has said lower border of T4. Anyone else who has the same opinion? She is also saying lower border of T4. Very good. I would say it is you have to choose the most appropriate answer in this case. Neha Kalita is saying 77. The answer is B. Saini is going for D. Saini, why are you saying D? Do you have any reason why you are saying D? Neha, no, not at all. ये आंखों से पता चल रहा है क्या? यार एक्चुअली मैं सोया नहीं कल रात को. हॉस्टल की लाइफ थोड़ी ऐसी हो जाती है, बट एनीवेज. So 77, the answer is option B, that is the lower border of T4. That is the most appropriate answer. Otherwise, I would have gone with T4, T5 if that was an option, because it is at the level of the sternal angle, so it's actually even a little lower than the lower border of T4. But ठीक है, L4, L5 is the place where this happens. So that is the answer that we are going to go with. Okay, lower border of L4 is the correct answer. So that is C. You can see here that it begins at the cricoid cartilage, which is at the level of C6, and its bifurcation takes place at T4, T5, which is the sternal angle, which is the landmark at the sternal angle. Remember, what is the mnemonic for the structures that are there at the sternal angle? So I told you a mnemonic for whatever happens at the sternal angle. The mnemonic was MAD RAT BP. MAD RAT BP. Right? So there is a mnemonic for that. You can, if you haven't watched, go ahead to Let's Crack NEET PG, go to Anatomy Basics. You will find a video on sternal angle that has been made by me. I've explained this mnemonic. Okay, so there are a lot of events that happen here. You should know all of these events. Okay, R से जैसे ribs count करने का होता है, A से aorta का होता है, ठीक है. T से trachea bifurcation. T is for base of the heart. It's the upper limit of the base of the heart. Okay, D is regarding the thoracic duct. Something happens for the thoracic duct here also. Okay, then this A is for the azygous vein. This M is for the mediastinum. This P is for the P that is left is for the pulmonary trunk. Pulmonary trunk also and plexus also. That is everything that takes place at the sternal angle. ठीक है, तो ये याद मैड रैट बीपी से बहुत अच्छा होता है. Mad. So there's a mad rat. Because he's mad, his BP is high. Right? That's how I try to remember this. एक और ये डिफरेंस होता है between the right bronchus and the left bronchus. Which is more horizontal? The left bronchus. Which is more steeper? The right bronchus. Which is wider? The right bronchus. Which is more shorter? The right bronchus. So if anything, if any foreign particle comes, it has a tendency, all the factors, they favor that it goes into the right bronchus. It is wider, it is shorter, it is steeper. So everything will want to go inside the right bronchus. ठीक है? Remember that. Question number 78. Question number 78. Okay. So Zubair is saying that 29 December you are having your prof exams. Kindly have same sessions on embryo, histo and physio, right? Okay. So I'll try to have a few of these sessions. So the thing is that for this month, my number of hours left is limited. I have around, so see, first of all, my Telegram channel is at the rate NEET PG Chetanya. You can subscribe to my Telegram channel. Go ahead and watch all my previous videos. ठीक है, उसमें जो भी anatomy physiology के topic cover होंगे, you can watch those. ठीक है, MCQ session चाहे skip कर लो, go and watch those theory videos at least. ठीक है, anatomy basics करके playlist है YouTube पे, वो सारी देख डालो. Embryo, I will try to cover some aspects. ठीक है, histo I will try to cover. Somebody said GIT and urinary, I'll try to cover. Physio, I told you I am preparing a plus course. ठीक है, तो इसकी एक plus subscription है. Plus course बनाने की सोच रहा हूँ मैं इस पे. That is GI physiology. That I will do in this month itself. That I will do in this month itself. Okay. So I'm taking that from the 22nd November to 25th November. So if you want, you can take a 1 month plus subscription. 1 month का plus subscription ले लो. Take it in December. I will say don't even take it in November. Take it in December so that you can prepare for your profs from the 1st to 22nd, 29th of December. ठीक है, उसमें बहुत सारे एजुकेटर्स ने कोर्सेज बनाए होंगे. मेरा जीआई फिजियोलॉजी का देख लेना. आई विल मेक वन इन दिसंबर ऑल्सो. गो अहेड एंड वॉच दैट. ठीक है, 2 टॉपिक बहुत अच्छे से ये तैयार हो जाएंगे. बाकी एजुकेटर्स से पूरा कंटेंट मिल जाएगा. ठीक है, कैडावरिक इमेजेस का भी ले दूंगा, डोंट वरी. 78 you guys are answering as तो तुम्हें स्पॉटिंग के लिए चाहिए होगा ना, राइट. Surface marking of aortic valve 78. What is the answer? The correct answer is option A. Sternal end of the left third costal cartilages. Okay, you can also encourage your friends to be watching these videos. Not on the right third costal cartilage, it is the left third costal cartilage. Just have a look here. This is the, so there are two things. One is the surface marking of that valve. One is the surface marking. One is known as the auscultation area. One is known as the auscultation area. And they are not the same. Remember, they are not the same. कभी भी ये याद रख लेना कि ये same नहीं होते हैं. Auscultation area is different, and this is where you have to hear for the sounds of that valve. You have to hear for the sounds of that valve. So this is made based on the fact कि कहाँ पे कौन सा valve सबसे best सुनता है, and this is based on the fact कि कहाँ पे होगा valve. ठीक है, so they are not the same. First thing. So look at this surface marking. The surface marking is done with the pink color. Surface marking is done with the pink color in this diagram. Just have a look. The structure that is there shown to you This is the pulmonary valve. This A is for the aortic valve, M is for the mitral valve, and T is for the tricuspid valve. So the aortic valve, as you can make out, this is the left side of the heart. So this is the left side of the body. This is the right side. So you can make out this is the third costal cartilage. So the aortic surface marking is at the sternal end of the left third costal cartilage. Left third costal cartilage. ठीक है? तो ये हो गई इसकी surface marking. And what about aortic area? What about aortic area? That is towards the right side. Under the that is under the right sternal end at the level of second coastal cartilage. ठीक है? तो ये देखो ये तो काफी तो जो auscultation area होते हैं, they're relatively far away, they're relatively spaced away. Others, if you look at the surface marking, they're relatively very close. But when you to listen with the stethoscope, they are relatively drawn very far so that you can hear them perfectly, right? जो साउंड होती है वो वेसल के थ्रू भी ट्रांसमिट होती है ना थोड़ी बहुत, तो दैट इज व्हाई यू गो अराउंड दिस वे. Look at question number 79. Question number 79. 79, you guys are answering as B, base of the lung, right? You guys are answering as base of the lung. The answer is not the base of the lung. The answer is option C, sequestrated lung tissue. The answer is option C, sequestrated lung tissue. Okay. So what happens? What is sequestrated lung tissue? Basically, pulmonary sequestration refers to abnormal lung tissue, right? It is abnormal lung tissue that is not connected to the bronchial tree. ठीक है, ऐसे ही पड़ा है, बस tissue बन गया है. It is not connected with the bronchial tree. It does not provide any ventilation, but it is just occupying space. So it is a space occupying lesion. And it is not connected with the pulmonary arteries also, so it does not get supplies from the pulmonary artery. Instead, it is supplied by some systemic artery. Usually it comes from the thoracic or from the abdominal aorta. It can come from the thoracic or it can come from the abdominal aorta. It can come from any of these, and it can also be present inside one of the lobes. It can be considered within the visceral pleura, or it can also be outside the it can be intralobar, that is inside the substance of the lung, so it can be present anywhere. So question number 80, all of the following lie between the first rib and the apex of the lung except question number 80. Right. 80 you guys have answered as D. Utsab and Mishti. I am relying that you guys are smart people. So 80th you are answering as D. गलत हो गया गलत हो गया गलत हो गया गलत हो गया. The answer is going to be thoracic duct. The answer is going to be thoracic duct. Now, why is the answer going to be the thoracic duct? Thoracic duct. बताओ. Does anyone else? हाँ. Okay, so Sam has given the correct answer. 80th का A. C. Utsab and Mishti had said D. Sam has given the correct answer that it's the thoracic duct. Because see, the thoracic duct, it extends till the root of the neck. It's not lying between the first rib and the apex of the lung. That is not going to be present here. ठीक है. 81. Which of the following is not supplied by the right coronary artery? Very important question. Very, very, very important question. And I had discussed this in my class on coronary circulation. Eighty-one. The answer is D. Right bundle branch. Right bundle branch. Okay. So look here. Blood supply of the conducting system. Okay. So Zubair also knows the mnemonic swan. Very good. तुमने बता ही दिया तो स्वान में सारे स्ट्रक्चर्स बता दो. What are the swan structures? 81. Blood supply of the conducting system. SA node, AV node, bundle of his divides into the right bundle branch, left bundle branch. SA node, AV node, bundle of his mostly supplied by right coronary artery. Left bundle branch is supplied by both left and right coronary artery. But the right bundle branch, it is supplied exclusively by the left coronary artery, not supplied by the right coronary artery. It's a very weird thing कि लेफ्ट वाली को दोनों सप्लाई कर रहे हैं बट राइट वाली को सिर्फ लेफ्ट वाली सप्लाई कर रही है. ऐसा भी नहीं कि राइट वाली को सिर्फ राइट वाली सप्लाई कर रही है. Okay, so not supplied by the right coronary artery. Remember, right bundle branch, it is supplied by the left coronary artery. Answer for 81 is going to be D. SA node, 65% of the time supplied by the right coronary artery. AV node, 90% of the time supplied by the right coronary artery. Okay, so commonly they are all supplied by the right coronary arteries. Again, question has been asked. So, had you looked at the picture carefully, I had shown you a picture of surface marking. So, this is why I have kept this question to make sure that you remember what are the images I am showing you. Are you learning from those images? right? So 82 you are saying C. 82 you guys are saying C. Very close. You're thinking towards the right direction. Okay, you are imagining that the mitral valve it is present little lower to the aortic valve. That's very good. So you are thinking fourth cartilage, fourth costal cartilage. That's very good thinking. See, look here. Now tell me the answer. Just have a look here. This is the fourth. This is the sternum. Now tell me the answer. This is where the mitral valve is located. Now I'm giving you again time. Now think. So Mishti, do you want to change your answer? Sam, do you want to change your answer? Should I do one thing? सेम स्लाइड पे रख देता हूँ रुको यस सो नाउ यू ऑल हैव बीन एबल टू आंसर करेक्टली तो देखा ओपन बुक टेस्ट कर दो तो सब सही आंसर दे देते हैं कुबेर का मैं आंसर आ गया देखो हियर यू सी दिस इज द so it is not in the intercostal space, it is not in the mid-clavicular line, it is there behind the sternum only. So it is behind the sternal end, it is towards the left side, it is towards the left side, behind the sternal end of the left fourth costal cartilage. 82 the answer is going to be option A. 82 the answer is going to be option A. 83. What is the level of the vena cava opening? What is the level of the vena cava opening? Vena cava opens into the right atrium at what level? Superior vena cava opens into the right atrium at what level? Watermelon sugar. Hi. Watermelon sugar. Very simple. If you watched my video on the sternal angle, अब समझ आ जाएगा थोड़ा दिमाग लगाओ. What do you know about vertebral levels through the sternal angle? जब भी vertebral levels की बात आती है ना guys, if you know about the sternal angle, you will be able to answer most of such questions. You're answering T4. हो थोड़ा सा और सोचो. T4 कैसे आंसर कर दिया? Think about the. चलो I'll give you a hint. Think about the azygous vein. Think about the azygous vein. Think about the azygous vein, then you will be able to answer. Superior vena cava opens into the right atrium at the level of. Mishti is also seeing T4. Unfortunately, all of your answers are wrong. The correct answer is option D, T5. Now, why is T5 the correct answer? Think of this. Azygous vein, it enters the superior vena cava. It enters the superior vena cava. The superior vena cava, it is coming down. This is the right atrium of your heart. Azygous vein, it enters somewhere here, right? That is where the azygous vein enters. Something like this. So azygous vein, where does it enter? At the level of the sternal angle. So this level is the T4 T5 level. This is T4 T5. Yeah, where it enters. Now the superior vena cava, it opens into the right atrium a little below this, a little below this. Okay, there is some distance. So जब तक यहाँ पहुंचोगे तो obviously T4 T5 से नीचे होगा. तो T1 नहीं हो सकता, T3 नहीं हो सकता, T4 नहीं हो सकता. तो obviously आंसर क्या होगा? T5 superior vena cava opens into the right atrium at the level of T5. Very simple. All you have to do is think of the sternal angle and apply a little brain. Think of the sternal angle and apply a little brain, nothing else. Question number 84. Opening of the esophagus into diaphragm is at the level of. दृष्टि ने इमोजी दे दिया. Right. So opening of esophagus into the diaphragm is at the level of T10. Very good. You all are aware. बड़े फटाफट आंसर आ गए कि डायफ्राम की ओपनिंग तो T10 पे होती है, सबको आता है. शाबाश. 85 पे चलो. टाइम नहीं वेस्ट करेंगे. कल फंडा बताया था इसका. Now think why this question has been asked. थोड़ा सोचो, याद आ जाएगा. नहीं तो लगेगा कि ये डेटा क्या पूछ लिया है, ये कैसे पता होगा सेंटीमीटर वेंटीमीटर. Why is this data been asked? Think of it. Why? Also, why is this important? बताया था. थोड़ा दिमाग लगाओ guys. Think of esophageal constrictions. Think of esophageal constrictions. No, the answer is not B. The answer is not B. The answer is not C. You guys are wrong. अब मैंने दो गलत बता दिए हैं, अब तो मतलब बहुत ही गड़बड़ हो जाएगी. Yes, so whenever you're inserting something into the esophagus, so you commonly have to insert anything into the esophagus. You might have to look at the esophagus. You might have to put a tube inside for some purpose to have a look into the esophagus to survey the esophagus, kind of an endoscope, right? So you have to know that where you will have the sphincter, where you will have the various constrictions of the esophagus, how much away from the upper incisors. Why you are asking from the upper incisors? Because you have to know how much from the mouth, how much deep you can go from the mouth, right? ये वहीं से आइडिया लगेगा ना तुम्हें, बिकॉज ट्यूब कितनी अंदर तुमने डाली है, तो वो तो तुम अपर इंसाइजर से ही कैलकुलेट कर सकते हो, है ना. ट्यूब इसके बियॉन्ड विजिबल नहीं होगी, तो दैट इज वाई यहां से कैलकुलेट कर रहे हैं. Okay, so Sam has given a decent answer. अदरवाइज इन सेंटीमीटर इन सेंटीमीटर्स हाउ मच इज 1 इंच इन सेंटीमीटर्स बताओ जल्दी बताओ मेरे को बताना पड़ेगा यार देखो क्वेश्चन आएगा तुम्हारे प्रॉफ एग्जामिनेशन में इसका हाँ 2.5 सेंटीमीटर सी esophagus when you look at the esophagus there are constrictions of the esophagus and I told you about three important constrictions. What were the three constrictions? Upper constriction that is called as the cervical constriction or also called as the pharyngo-esophageal junction क्योंकि pharynx और esophagus के junction पे है right. Then I told you that there is a bronchio-aortic या फिर aortobronchial ऐसा कुछ बोल लो ठीक है. Basically due to arch of aorta and due to left bronchus. Then there is one due to diaphragm so that is called as diaphragmatic. And यहीं पे होगा तुम्हारा lower esophageal sphincter यहीं पे होगा lower esophageal sphincter 6 9 to 11 15 ये होता है लेवल्स इनका ओपनिंग का तो दिस इज इन इंचेस फ्रॉम द अपर इंसाइजर्स तो 6 9 15 याद करते होते हैं 6 9 15 तो बेसिकली जो लोअर इसोफेजियल स्फिंक्टर है वो डायफ्राम के लेवल पे होगा तो दैट विल बी 15 इंचेस फ्रॉम द अपर इंसाइजर्स दैट इज गोइंग टू बी 15 इंचेस फ्रॉम द अपर इंसाइजर्स अब 15 इंटू 2.5 कर दो जो आंसर आएगा वो आंसर है डेफिनेटली 25 से ज्यादा है और अच्छा खासा ज्यादा है ठीक see now look at why these options are given this is 6 inches this is 9 inches this is 11 inches and this is 15 inches तभी ऑप्शन ऐसे बनाए हैं ऑप्शन में उसने क्या किया है कुछ नहीं किया है इंच को सेंटीमीटर में कन्वर्ट करके बताया है बस तुमने बस 6 9 11 15 में से चूज करना था 15 होगा आंसर दैट इज द डिस्टेंस ऑफ द डायफ्रामेटिक कॉन्स्ट्रिक्शन ऑफ द ईसोफेगस क्वेश्चन नंबर 86 आयोटिक एरिया फॉर ऑस्कल्टेशन देखो फिर से क्वेश्चन आ गया ऑस्कल्टेशन वाले चार्ट से पहले क्या पूछ रहा था मैं सरफेस मार्किंग अब मैं क्या पूछ रहा हूँ सरफेस मार्किंग नहीं पूछ रहा अब मैं कुछ और पूछ रहा हूँ right so aortic area for auscultation overlying the chest wall it is located at where is it located at so second intercostal space on the right side very good brilliant answer so you think that aortic it is located upward ठीक है तो ये रही second ये रही third इसके बीच में located है and ये हो गई aortic area for auscultation ठीक है area for auscultation surface marking अलग होती है So area for auscultation, it is located in the second intercostal space and it is located on the right side. It is located on the right side because देखो aortic vessel यहाँ से निकलेगी राइट को जाके फिर aortic arch बनाएगी लेफ्ट को, ठीक है. aorta लेफ्ट पे होती है बट aortic area towards the right. Aortic area is towards the right, whereas the trunk that will escape from the pulmonary से जो निकलेगी वो ऐसे होती है, ठीक है. Then it bifurcates. So remember this, keep this on your head that although right और left का फंडा कुछ और है, but here you have to remember that aortic, it comes out like this and then it curves like this. Pulmonary, it comes out from here and then it bifurcates. Okay. So initially the aorta is present towards the right. Hello. Sorry guys, sorry about that. Right. So you'll be able to make out the aorta where it is located. So moving on to question number 87. Hyaline cartilage of the respiratory tree extends up to. Right. So answer is going to be guys, आंसर कर दो. राइट, साइनी ने मेरा पॉइंटर देख लिया. आंसर इज गोइंग टू बी ऑप्शन डी, ब्रोंकाई. ठीक है. तो हाइलिन कार्टिलेज, you know, it is present in the respiratory tree because hyaline cartilage forms the rings. Hyaline cartilage, it forms the rings, and वो rings, they are present up till the bronchi also. In fact, they are present up till the bronchi. ठीक है. bronchiole तक नहीं जाते हैं, they end at the bronchi. ठीक है. tertiary bronchi तक, bronchioles में नहीं जाएंगे. प्राइमरी ब्रोंकस, सेकेंडरी ब्रोंकस, टर्शियरी ब्रोंकस तक प्रेजेंट होते हैं ये. ठीक है. तो ब्रोंकाई में खत्म हो जाता है. जहां ब्रोंकाई खत्म हो गए और जहां से ब्रोंकियोल स्टार्ट हो गए, रिमेंबर हियर इट इज रिटन ब्रोंकियोल नॉट ब्रोंकाई. ठीक है. तो ब्रोंकियोल्स में नहीं होते हैं हाइलिन कार्टिलेज. दे आर टॉकिंग अबाउट, सो बेसिकली व्हाट इज आस्किंग इज टिल वेयर डू यू हैव कार्टिलेजिनस रिंग्स. ये तो तुम्हारा 11th 12th का पीएमटी का क्वेश्चन होता था. दिस यूज्ड टू बी अ क्वेश्चन ऑफ एआईपीएमटी, राइट? Not a question of PG entrance, but they have framed it in a more twisted way for your PG entrance. Okay, where they have said hyaline cartilage. You should know that these are made up of hyaline cartilage, and then you will see that they are present up till the area of bronchi. Okay, okay, Saini knows the correct answer. Sam, Zubair, Mishti, see, you guys know the correct concept. You are thinking tertiary bronchi, but the option says tertiary bronchiole, so you will go with bronchi. You will go with bronchi. Okay, just read the question carefully. If it says tertiary bronchi, obviously that's a better answer. Question number 88, length of adult trachea. Guys, I asked this yesterday. This is a repeat question from yesterday's quiz. So if you have watched yesterday's class, you will be able to answer. Rest you will be not able to answer. ठीक है. कल ऑप्शन कुछ और थी, आज ऑप्शन थोड़ी डिफरेंट है. ये ऑप्शन थोड़ी बेकार है एक्चुअली. तो सोचो ट्रैकिया कितनी बड़ी होती है. कैसे लगाओगे अंदाजा? Yes, the answer is option B, 10 to 11 centimeter, right? Because वैसे 11.8 होता है कॉमन, बट तो इसलिए 10 to 13 इज अ गुड एस्टिमेट. 10 to 11 ऑप्शन में 10 to 11 आंसर कर देंगे हम. क्वेश्चन नंबर 89, sympathetic supply to the heart. गाइस ये तो कर लो, आराम से कर लो, मतलब बहुत आराम से हो जाएगा ये तो. थोड़ा दिमाग लगाओ क्या होता है सिंपैथेटिक इनर्वेशन. कहाँ से कहाँ तक होता है पहले ये बताओ मेरे को सिंपैथेटिक इनर्वेशन. Very good. I think you used your brains, Zubair and Sam, T1 to T4. So first, see sympathetic supply. Any sympathetic supply has to fall in the thoracolumbar outflow. The basics will not change. It is thoracolumbar outflow. So T1 से लेके L2 तक हो सकता है. T1 से L2 के बाहर हो ही नहीं सकता. T5 C1 कट गया, C1 to C4 कट गया, सब कट गया. ठीक है. अब देखो हार्ट अप्रोक्सीमेटली कहाँ पे होता है. T5 to T9 तो बहुत नीचे चला गया है. ठीक है. इतने सारे ऑर्गन्स है नीचे. इंटेस्टाइन है तुम्हारा पूरा, ये सारा विसरा है एब्डोमेन में, उसको भी तो सप्लाई करना है. तो T5 to T9 तो बिल्कुल नहीं. तो बचा क्या, T1 to T4. T1 to T4 से सप्लाई करा दो. ऑलमोस्ट शुरू वाला जो पार्ट होता है वहीं से सप्लाई होता है. तो द आंसर विल बी T1 to T4. दैट्स द सिंपैथेटिक सप्लाई ऑफ द हार्ट. दैट्स द सिंपैथेटिक सप्लाई ऑफ द हार्ट. वेरी सिंपल. क्वेश्चन नंबर 89. क्वेश्चन नंबर 90. क्वेश्चन नंबर 90. जल्दी बताओ. वेरी गुड. लोअर बॉर्डर ऑफ cricoid cartilage. So I had shown you an image also. पीछे रह गई. हाँ ये रही रही. ये देखो. इट स्टार्ट्स एट द लोअर बॉर्डर ऑफ क्रिकॉइड कार्टिलेज एंड उसका लेवर क्या होता है. ये तो वैसे ट्रेकिया का है. इसोफेगस की बात हो रही है. लोअर बॉर्डर ऑफ क्रिकॉइड कार्टिलेज में दोनों शुरू होती है. एंड दैट लेवल इज C6. दैट लेवल इज C6. That level is at the level of C6. Esophagus starts at the lower border of cricoid cartilage and it keeps on going down. It forms the stomach. Esophageal opening is at which level? Esophageal opening is at which level? It is at T10. Esophageal opening is at the level of T10. Okay. क्वेश्चन नंबर 91 पे चलेंगे. Today we'll try to stop at 95. Rest 50 questions we will do tomorrow. Or okay, let's try to do the entire 100 today itself. New people who are joining in, please do press the like button for your video. Don't forget to press the like button on the video. That would really motivate me. That would motivate me to take How many more sessions for you guys? The answer was 91. The answer was 91. Do you know the surface marking of the oblique fissure of the lung? नहीं पता तो छोड़ दो. देखो ये देख लो, मार्किंग देख लो पहले. सरफेस मार्किंग फॉर oblique fissure of the lung. ठीक है. तो ये लंग की सरफेस मार्किंग से, आई नो दैट वी डोंट स्टडी surface anatomy much, but this is from the PG perspective. One question has been asked. Might be relevant somewhere in surgery also. See here. This is the oblique fissure of the lung. This is the oblique fissure of the lung. This is present on the which side? Right side. Okay. Right side पे present है. That is how it goes. So you start from the spinous process of T3. You come anteriorly to the sixth costal cartilage. You come anteriorly to the sixth costal cartilage, going along the fifth. ठीक है. तो यहाँ पे सिक्स कोस्टल कार्टिलेज तक आते हो एंटीरियरली, और फिर ऊपर चले जाते हो थोड़ा सा फिफ्थ तक. तो बेसिकली व्हाट आर यू इंक्लूडिंग? फिफ्थ रिब, सिक्स कोस्टल कार्टिलेज एंड T3. ऑल ऑफ दीज आर इंक्लूडेड. T3, फिफ्थ रिब एंड सिक्स कोस्टल कार्टिलेज. तो ऑब्वियसली ऑब्लिक फिशर ऑफ द लंग उसके नीचे नहीं जा रहा है, तो ऑब्वियसली आंसर होगा ऑप्शन सी, सेवंथ रिब. सेवंथ रिब विल नॉट बी इंक्लूडेड. So 91, the answer is C, not option B. Zubair, Sam, think of it yourself. If sixth coastal cartilage is included, then automatically fifth rib has to be included. And automatically in some way, it is very possible that the fifth rib will be included. But seventh rib, then it becomes a little unlikely for that. ठीक है? जब posteriorly T3 से start होगा, अनुराग, not yet. They were scheduled to be held in July. I even came to campus, but they've been postponing it ever since. So the seventh rib is done. So let's move on to question number 92. Aditya Anurag got into AIMS Bhubaneswar. Congratulations, Aditya. You've been my student on Unacademy. Sorry, Aditya Anurag, I did not recognize you. You're probably with a different name here. Question number 92 is the next question on your screens. Right. Absolutely correct. Most of the blood supply of the liver, it comes from the portal vein. Only some part of it, a small percentage of it, is coming from the hepatic artery. So 80% it is coming from the portal vein, and 20% it is coming from the hepatic. That's going to be the right. Question number 93. If you watch a video full 3 hours 2 months ago. 2 months ago, what was that video? November. Nice. 92, you all are right. 92, the answer is B. Guess this, guys. Guess this quickly. 93. So first, tell me what is the hemiazygous vein? What is the hemiazygous vein? Anurag Joshi, Anatomy, where do you read it from? So basically, whenever I prepare any class, I check everything from Gray's Anatomy, and that too, I prefer to go for Gray's Anatomy, the original, that is 41st edition that is going on. That's called as the Mother Gray's, only called as the Mother Gray's, right? Sometimes I refer to Snell's Anatomy for my lectures, and sometimes I refer to Keith and Moore, right? So these are the books that I use to refer when I prepare a lecture here on Unacademy. Everyday reading BDC. Matlab, I've read a lot of BDC. I've almost read the entire BDC. So although I would say that BDC is a fairly decent book, and I'm pretty satisfied with BDC myself. And if you are reading for your prof examinations, I would say you should go for BDC. So 93 hemiazygous vein, it crosses left to right at the level of, that's almost the level of T9, T8, right? It's T8, T9. So as you know that the hemiazygous vein, it comes from the left side and it drains the 9th, 10th, 11th posterior intercostal veins, and it drains the subcostal veins into the azygous, right? So if it is draining the 9th one, if it is draining the 9th intercostal vein, so it must be crossing over at somewhere around T8, T9, right? So it drains the upper left. Yes, no, not the upper left. Drains the lower left. See, it is called as vena azygos minor inferior. It's the accessory hemiazygos which drains the upper intercostal spaces, right? So here we are talking about the lower intercostal spaces. Yes, hemiazygous vein lies on the right. So essentially the system is, on the right side you have the azygos, on the left side in the upper part you have the accessory hemiazygos, and in the lower part you have the hemiazygos. That is how the piping is for your venous supply. Okay, venous system very important for your examination. So have a look here. This is your hemiazygos. This is your hemiazygos. It's crossing here at the level of T9, T8. This is going into the azygos. This one which is draining the upper intercostal spaces, giving the posterior intercostal veins here, that is the accessory hemiazygos. That is also draining into the azygos here. Both of them, they drain into the azygos, and the azygos goes up and it drains into the superior vena cava at the level of T4, T5. That is the level of the sternal angle. Okay, so that is the entire system of circulation here. Question number 94. Floor of fossa ovalis is a remnant of. Okay. 94. You are saying B, Mishti. Saini, you are also saying B. Floor of fossa ovalis is a remnant of septum secundum. बड़ा कॉन्फिडेंस है सब लोगों को. बड़ा कॉन्फिडेंस कहाँ से लाते हो? Ah, very good. Sam has corrected the answer. Anurag Joshi has given the right answer. Very good, Anurag Joshi. देखो, the answer is going to be septum primum. Floor of fossa ovalis is a remnant of septum primum. See, this is the floor of fossa ovalis. This is the floor of the fossa ovalis, and it is a remnant of the septum primum. ठीक है, ये देखो ऐसा kind of fossa ovalis का structure है ये. This is a superior view, right? So ये septum accessorium दिखाया हुआ है, false septum दिखाया हुआ है, which is false septum secundum, or it is also called as the interatrial ridge. Then rest is the true septum secundum, opening ostium secundum. ठीक है, so that is the structure of fossa ovalis. बाकी embryology part में है. I will take an embryology class separately here, not going into the details of everything. Question number 95. SA node का blood supply. ये मैं बहुत बार बता चुका हूँ यार, ये गलत मत करना. इनफैक्ट मेरे को परसेंटेज भी बताओ, कितने परसेंटेज में कौन सी होती है. Tell me the blood supply percentage wise. So guys, the next session would be thoracic MCQ part 3 that I will be taking. Thorax MCQ part 3. That is the last lesson on the MCQs of thorax that I will be taking tomorrow, right? And I will tomorrow probably be taking it a little earlier because this is kind of messing with my sleep schedule. So I'll try to take it around. You tell me what timing I should take it on. Tell me the time at which it's best for you. And then I am planning to do a free session on gastrointestinal physiology also, because I know I'm taking a plus course, but I want others also to practice at least the MCQs to at least understand the basic concepts. Okay, right coronary artery, approximately 60 to 65%. That's right. Answer is going to be option A. 60 to 65% of the people, they have this blood supply from the right coronary artery. Left coronary artery in 30 to 35% of the people. So we go with the main answer, that is the right coronary artery. Okay. Now, what about the AV node? If this question was the AV node, what would your answer be? Let's say I change the question. Let's say I make the question AV node. Now tell me the percentages. Now can you tell me the percentages for the AV node? Percentage for AV node. What percentage supplied by the, what percent of the population is supplied by the right coronary, and what percent of the population it is supplied by the left coronary artery? Can you tell me the time I should take on for thorax MCQ part 3? Yes, it's the same. The percentage is not the same. Right coronary artery supplies the AV node 90% of the times, and the left coronary supplies it only 10% of the times. Why? Because the AV nodal branch, it is a branch of the posterior interventricular artery. Remember Kashmir. So 90% of the times you will have right cardiac dominance. So 90% of the times AV node is supplied by the right coronary artery, 10% of the time it is supplied by the left coronary artery. Very important to remember. ठीक है? So that's about this. मेरे को बता दो thorax MCQ part 3 कितने बजे लेना है? क्वेश्चन नंबर 96 पे चलते हैं. ये अगेन बहुत इंपॉर्टेंट, बहुत इजी क्वेश्चन. 9 PM. क्या 90 का क्या मतलब हुआ? 90 तो कुछ नहीं बनी बात. 4 PM. चलो, सैम ने बोला 4 PM, तो 4 PM पे ले लेंगे. डन कर दो. Right, Zubair. हाँ. So Saini was saying 90% of the times AV node is supplied by the right coronary artery. Okay, correct. Name has been written by Zubair. Very good. So lower border of the lung is up to the level of rib at the mid axillary line. Which rib is up to the level of which rib? Okay, this question should say it is up to the level of which rib at mid axillary line. गलत मत करना. देखो, दो चीजों पे ध्यान देना होता है. Give attention to two things in this question. One, does it say lung or does it say pleura? First. Second, does it say mid-axillary line, mid-clavicular line, or vertebral? Right? So it can. So you understand it at three places for two different things. One is pleura, one is lung. One is pleura, one is lung. So be very careful. And also, at which place? Mid-clavicular is different, mid-axillary is different, and along the sides of the vertebra is different. Paravertebral region. Okay. Yes. Okay. So none of you is given the right answer so far. यार कोई इंसान तो सही आंसर दे दो. And I see there are a lot of people joining in right now. Guys, my Telegram channel is @NEET PG Chetanya. You guys can watch this video on 2x. If you feel it's a little slow in between, you can skip through the pauses. Do hit the like button on this video. I would really appreciate that from your end. ठीक है, एक बार like button दबा दो. Right. So now I've got the final correct answer from Sam. That is B. 96. The answer is B. See here. At the edges of the thoracic cavity, the pleura it extends lower than the lungs to form what is known as the pleural gutter. That is known as the pleural gutter. This extra region in which the pleura is hanging, that is known as the pleural gutter. Okay. So if I look at the mid clavicular line, so if I start counting the ribs from here, this is 1, 2, 3, 4, 5, 6. So at the mid clavicular line, this is where it is going to be. It is going to be at the lung is going to end at the 6th rib, but the pleura is a little below, so it ends at the 8th rib. Okay. So for the lung, then you talk about the mid axillary line, and then you talk about this is the mid axillary line, and then you talk posteriorly, this is the paravertebral line. Okay. So paravertebral line, तो ऐसे जो लंग है पीछे जाते जाते नीचे तक जाता रहता है. So for the lung it is 6, 8, 10. For the lung it is 6, 8, 10. For the pleura you shift it to 6 becomes 8, 8 becomes 10, and 10 becomes 12. So for the pleura it is 8, 10, 12. Remember, so you have to see if it is asked for the lung or if it is asked for the pleura, then you have to see which line is asked, mid-clavicular, mid-axillary or paravertebral. According to that, your answer will vary. These are the 6 possible answers. ठीक है, समझे इस बात को? Please put it in your head. Okay. Given the reference also from where I've taken this, Time Atlas, page 102, you'll find this. Okay. तो खत्म करते हैं. 3 क्वेश्चन रह गए हैं. 97, 98, 99, 100. 4 क्वेश्चन रह गए हैं. लेट्स फिनिश इट. Right. So 97 you all have been able to answer, but यार थोड़ा ध्यान से सोचो, लेकिन गलत आंसर कर रहे हो। सैम मिष्टी संगीत, मिष्टी हैज नाउ करेक्टेड her आंसर, राइट वेंट्रिकल। करेक्टेड क्या, गलती कर लिया और गलत कर लिया। लेफ्ट है, लेफ्ट एंटीरियर डिसेंडिंग आर्टरी, विडोज आर्टरी, लेफ्ट एंटीरियर डिसेंडिंग आर्टरी। ये क्वेश्चन कल भी कराया है। Results in ischemia of, the line that you might not be able to read is results in ischemia of। वजह से तो नहीं आंसर गलत कर रहे यार। लेफ्ट एट्रियम का इश्कीमिया नहीं हो जाएगा इतनी सी बात पे, ठीक है। लेफ्ट एंटीरियर डिसेंडिंग आर्टरी कहाँ पे होती है? लेफ्ट एंटीरियर डिसेंडिंग आर्टरी इज द एंटीरियर इंटरवेंट्रिकुलर आर्टरी। लेफ्ट एंटीरियर डिसेंडिंग आर्टरी इज द एंटीरियर इंटरवेंट्रिकुलर आर्टरी। लेफ्ट एट्रियम क्यों बोल रहे हो यार तुम लोग, मेरे को समझ नहीं आ रही इस बात की। इतना ऊपर कैसे चले गए? इतना ऊपर तो आर्टीरियल ब्रांच देती है लेफ्ट कोरोनरी आर्टरी, लेफ्ट एट्रियम के लिए। बट एंटीरियर इंटरवेंट्रिकुलर आर्टरी यार, फॉर गॉड सेक, लेफ्ट एट्रियम कैसे? ऐसे तो मत करो, ऐसे मत करो यार प्लीज, गड़बड़ हो जाएगी। लेफ्ट एंटीरियर डिसेंडिंग आर्टरी की ओक्लूजन हुई है यार, तो मेन चीज जाएगी तुम्हारी। दैट इज व्हाई इट इज कॉल्ड एज द विडोज आर्टरी, बिकॉज approximately 60% of the heart attack, 60% of the occlusions there because of the left anterior descending artery। लेफ्ट एंटीरियर डिसेंडिंग आर्टरी फटती है, औरत विडो बन जाती है एकदम से, विडोज आर्टरी। 97 the आंसर इज ए, एंटीरोलैटरल वॉर। लेफ्ट एट्रियम को कुछ हो गया तो एक बार को किसी को फर्क नहीं पड़ेगा, फर्क तो पड़ेगा खैर, बट ठीक है चलता है। लेफ्ट वेंट्रिकल मर जाएगा, बंदा मर जाएगा, ठीक है। तो एंटीरोलैटरल वॉल इफेक्ट होगी, ठीक है। एट्रियम मत सोचो, इट इज ऑल्सो कॉल्ड एज द एंटीरियर इंटरवेंट्रिकुलर आर्टरी। इट रन्स इन द इंटरवेंट्रिकुलर सर्कस, ठीक है। तो नीचे प्रेजेंट होती है यार। लेफ्ट एट्रियम की जो ब्रांच है वो सीधा लेफ्ट कोरोनरी से आ जाती है, ठीक है। तो लेफ्ट एंटीरियर डिसेंडिंग को नहीं सप्लाई करना पड़ता। ओके, क्वेश्चन नंबर 98, लेट्स मूव ऑन टू क्वेश्चन नंबर 98। नाइनटी एट का आंसर आना शुरू हो गया है। मिष्टी, सैम, सबको आता है यार 98 तो मेरे को लगता है। Guys, this is my Telegram channel. You guys can join this Telegram channel. My plus referral code is Chetanya 10, ठीक है। If anybody is taking a plus subscription, whether it be your brother, sister, के कोई भी ले रहा है आईआईटी के लिए, नीट यूजी के लिए, यूपीएससी के लिए, कोई भी सब्सक्रिप्शन ले रहे हो, to use my referral code, and I'll also tell you how to use credits। You can contact me on Instagram @chetanya.blue, and you can also contact me on my Telegram channel, that is @NEET PG Chetanya। Answer is umbilical vein and inferior vena cava, like all of you have written, ठीक है। So I've just taken this screenshot to show you what is basically the ductus venosus। Is acting here the hepatic portion of the IVC, the hepatic portion of the IVC, and you can make out here that this is the umbilical vein. It is connecting these two. It is connecting the umbilical vein and the IVC. So this is an embryonic image. Ductus venosus is also an embryonic structure. Later on, it closes. As you all know, ductus venosus, it will close. Ultimately, ductus venosus will close. Fine. Shall we proceed? Question number 99. Question number 99. Your second last question for today. Let's finish this quickly, guys. Second last question. Last के दो question सब लोग सही करने का try करो. Although मुश्किल है थोड़ा ये question. 99, you all are saying that the answer is going to be B, C7. Very good. Thoracic duct, it does end at the level of C7. So as you know, thoracic duct, where does it pass through? Thoracic duct, it merges into the left brachiocephalic trunk. So it ends at the level of C7. Thoracic duct, it ends at the level of C7. All your answers are correct. 99, the answer is going to be option. Last question, 100th question. 100 questions we have done so far from Thorax. 45 more to go, guys. Tomorrow, meet you all at 4 p.m. Tomorrow, please do join me at 4 p.m. for an MCQ class on Thorax MCQ part 3. Yes, at the angle between subclavian and IGV. Okay. Guys, do remember to hit the like button. You बताओ 100 का आंसर बताओ. जब सबसे पहले 100 का आंसर बताओ. E, medial and lateral. Very good. Sangeet, Zubair, Mishti, all of you are giving the right answer. Very good. Medial and lateral is the correct answer, in fact. Okay. So, thank you, Sangeet. Thank you, Zubair. Thank you, Mishti. Thank you, Saini. Thank you, Sangeet. Thank you, Sam. All of you guys have been constant viewers, right? Anurag Joshi, you can contact me on Instagram at the rate chetanya.blue, or you can contact me on my Telegram channel, that is at the rate NEET PG. There is a discussion group. Join that discussion group, and there you can send me text messages on that group. Okay, I'll make sure that I reply to. Okay, thank you, Anurag. So look at this here. This is the middle lobe. You can see that in the left lung you only have the superior and the inferior lobe. So when you are talking about the middle lobe, you obviously mean the right lung. You obviously mean the right lung. If somebody says middle lobe, don't ask which lung, left or right. It obviously means right lung. Use your brains, right? So it obviously means we are talking about the right lung. And when you talk about the right lung, you can have either the middle lobe is divided into the medial, lateral, and superior. It is divided into the medial, lateral, and superior. So these are these three bronchopulmonary segments, lung segments of this side, right? So medial and lateral therefore went as the answer here in this case. Okay. The superior is divided into apical, anterior, posterior. Inferior has anterior basal and lateral basal. On the When you talk on the left side, superior has apical, posterior, anterior, superior, inferior. Inferior has superior, anterior, medial, basal, and lateral basal. Okay. So that is about the lobes of the lung and the various segments related to the lung. Thank you so much for watching. Chetanya 10 is my plus referral code. Chetanya is my name, and 10 is the percentage discount you get as a direct discount. ठीक है, ये direct discount है 10%. तो Unacademy सीधा दे देगी, फिर 10% credits लगा देना. Apply credits for the remaining 10% off. Okay, you can contact me to talk anything about this discount, and do subscribe the channel Let's Crack NEET PG. Do hit the subscribe button, press the like button for this video, drop a comment in the comment section if you have to say something. Do hit the like button and hit the bell icon for notifications so that you know when anybody is online. Meet you tomorrow 4 p.m. for tomorrow's MCQ session. Thank you so much. Thank you, Sam.